This summer, Bob was not feeling well. He was feeling very weak. So we took him to an ER, and they diagnosed him as having congestive heart failure. And they said, you need to go back and see your cardiologist. We went and visited the cardiologist. He said, you have severe aortic stenosis. He said, you need to go into the hospital immediately. With the aortic stenosis, the only thing possible right now is to have the valve replaced. And so that's what brought us in to the other hospital, thinking he was going to have the TAVR. And while we were there were a lot of twists and turns that happened. It was just one delay after another. During all this time, Bob was getting weaker and weaker and weaker. I'll never forget, it was a Saturday afternoon, and in comes a weekend on-call doctor. And he said, your husband is not able to make the TAVR. He said, it's entirely too risky. And we said, what do you mean? And he said, well, I think it's time to tell y'all that your husband really needs to go into hospice care. At that moment, I felt like the earth had stopped. My world had stopped. This was the 25th day he was in a hospital, and we just were so surprised he'd come to this. The next morning, my cousin, Dr. Mark Provenza, called and said, hey, Bernie, how's the TAVR? Have y'all had it yet? And I said, oh no, Mark, we haven't had it. They're not going to have it. In fact, they want Bob to go into hospice care. I just don't know what to do. He said, Bernie, I know a doctor who has performed hundreds of TAVRs. Do you mind if I ask him? I think he'd be happy to help us. And it wasn't much later that day, in walks a doctor, and he says, I'm Dr. Reeves. I've heard about your situation, and I wanted to meet you and check out the whole situation. He came back later on, that around midday, and said, I've done my research, I've done my consultation, and I'm going to accept the job, and I would like to perform the TAVR on Dr. Bob. I'm going to transfer him now to CHRISTUS Highland Hospital. So as it turned out, that Monday morning, he had the TAVR. It was successful. We were all elated, and it was unbelievable to see my husband not only feeling better and starting to function. He's alive now. He was alive. It's like the blood started flowing all through his body, and all his organs were just waking up and starting to function like they were supposed to. I had never experienced a hospital like CHRISTUS Highland before. I had never experienced personnel, staff, nurses, therapists, doctors like I witnessed in CHRISTUS Highland. They were all working towards that one goal. They all wanted to help Bob. They knew what to do. They all knew their jobs, and they did it without complaints, with a smile on their face and confidence. They all had confidence. My husband was a biology professor at LSUS. Dr. Reeves said, it was my honor to perform the TAVR on your husband. He has done so much for mankind. He's done so much for our community that I felt like I owed this to him. If it had not been for Dr. Reeves, I honestly believe my husband would not be here today.